Again, have all information you need to report available before you start talking. So that includes vital signs. For example, when we talk about getting a blood pressure and heart rate, the hospitals want to know that information, but it's not helpful for you to not have that information before you start your report. When you give a radio report, you want to report the status of your patient's airway, breathing, and circulation, their ABCs, their chief complaint, and their vital signs, especially if they're not within normal limits. You want to send it early. The reason that we even call the hospital at all is to basically give them some lead time to help them prepare if there's anything they need to get ready. So the sooner we can notify them, the more time that they have to prepare the hospital for the patient we're bringing them. Use standard medical terminology, and if you haven't listened to the medical terminology lecture yet, you're going to. But use the medical terminology, and if you don't know the word, then use plain English. He has a cut on his arm. Is fine. Repeat all orders. So if you call in and talk to a doctor, and the doctor says, I want you to give aspirin, then make sure you clarify what he meant. Sir, I understood you wanted me to give aspirin, but could you confirm the dose? Oh, I wanted you to give 324 milligrams of aspirin. Okay, sir, 324 milligrams of aspirin. Thank you. So ask what the physician said, or if you think an order is incorrect, ask him or her to repeat the order. Avoid ongoing transmissions. This says stop talking every minute and assure that the receiving station is copied. But to be honest, if you're talking for longer than a minute, your report is way too long. Too long. When we do practice scenarios, you will practice giving reports, and your goal is to give your non-critical reports in less than 30 seconds, and any critical patient reports, keep them to under a minute. Use a standard format for reporting the information. Report the same way every time. I like to use age and gender, chief complaint, some indication of vitals, so vital signs or perfusion status, level of consciousness, and then any interventions, and an ETA. But that could be as simple as Medic 1 is coming in with a 49-year-old female complaining of chest pain. Her vitals are within normal limits. She's alert and oriented. We've given her 325 milligrams of aspirin, 3 nitroglycerin tablets, and we'll be there in 5 minutes. So it doesn't have to be long-winded. It can be very simple. So when you don't use the standard format, aside from looking silly, you don't necessarily get all the information provided. Time's going to be wasted. Patient care may be delayed at the hospital. Attempts to get the needed while the hospital attempts to get the needed information, and everybody's going to be frustrated. Nurses and you and the patient, you're all going to end up frustrated. The better the picture you can paint for the receiving personnel, the better prepared they will be to receive your patient. They need to know certain things. For example, if your patient's not breathing and you're having to breathe for them, they need to know that. They need to prepare. They need to get the right personnel in there to prepare to breathe for this patient. If you had to do CPR on your patient, they need to know that too, so they can prepare for them. Remember, your job is to communicate, not to show off. So here is your patient report. Number 1, identify yourself. Service unit number, possibly personnel ID, but not always. So if I was going to a hospital that would get ambulances from lots of services, I would say which service I was from, and then, Medic 13 or Medic 14 or whatever medic unit I was on. Identify the patient, but no names. Age, sex, and sometimes weight. This is true for cardiac patients that are going to the cath lab. That's really the only time you give the weight, is a cardiac patient going to the cath lab. They want to know the weight there. Then you tell them what's going on. What's the cause, if there's a mechanism. So if somebody was in a car accident, for example, Patient was driving a sedan-style vehicle that rolled over 6 times. And you talk about the chief complaint. The patient is complaining of back pain. Physical exam information. Again, this is going to depend on kind of where you are and whether this is normal or abnormal. If everything is fairly normal and within, what we call normal limits, it's okay to say that. And if something's outside of normal limits, that's really when I would focus in and say, hey, patient's blood pressure is high. As far as this other stuff, the pupils, skin, neurological condition, vascular signs, I wouldn't do this on my radio report to the hospital, but when I'm actually transferring patient care, that is when I would tell the nurses about the pupils, the skin, any neurological conditions, vascular signs, and then all of my pertinent findings in order from head down to their toes. And they would also get all of my vital signs at handover when I transferred care. Also given during patient care transfer to a nurse, past medical history, so this includes anything they tell you they've been diagnosed with, anything they tell you that they're allergic to, and any medications they're taking, as well as the dose. Next step, talk about the treatment. What treatment have you given? And if you're giving a report from the ambulance, anything that you've given prior to transmission, and then confirmation of any treatment that the doctors are ordering for you. When you get to the hospital, this will basically be all of the treatment. I'm going to abbreviate treatment TX, treatment. Any changes after the patient's treatment? Who's their physician, if they have a particular physician? This is actually pretty common with your OB patients. They always want to know who the patient's obstetrician is so they can send them a message. Your destination. Theoretically, you know your destination because that's who you're calling, but it may be that you're going to the obstetrics department. It may be that you've been told to go to the cath lab. Your ETA, or your estimated time of arrival, and that's given in minutes. So we would say ETA 5 minutes. And that would mean our estimated time of arrival is about 5 minutes. And then if you have some sort of transport code for your patient, you can include that as well.